Today's a good day.
Today's a good day. Tell me why you say that.
So I think people have probably heard by now that we had to close down our community-based sites due to a lack of material called reagent. The UC Davis was suddenly kind of left in the lurch, and so we had to close down those sites. But we were able to work out a deal with the National Guard to take on those sites for the next week or two. And now I think we'll be ready to announce in the next couple of days that we're going to have a ongoing long-term contract with a local entity that'll allow us to not only serve those 5 community sites, but to add an additional 5 as well.
That's huge. This is a big development.
It's good. We'll see we'll see if it comes through for sure.
Okay, so
I'd say it's 95% likely.
That's amazing. Okay, so just so I have that correct, you're saying there's an ongoing long-term plan to partner with a local entity to open
UC Davis, yes, to open to continue to have these 5 community-based sites and add up to 5 new ones as well in the next 3 weeks.
Wow. Any idea of where those new 5 could open, or is that still?
So 3 of the new 5 would be in North Highlands, Grant High School area, and Rancho Cordova, and then we're probably going to have 2 more that we'll go to as well.
Amazing. Awesome. Okay, good. And are you able to name that entity or not yet because it's still too soon?
Too soon. Okay,
awesome. And we should know for sure within the next couple of days?
I would say we'll know by the 1st of next week. But
awesome.
The National Guard is taking over these 4 of the 5 sites starting next Tuesday in Natomas, and they're serving Tuesday, Wednesday, Thursday, Friday at our 4 sites that are currently open. And then they'll go on for the next week or 2, depending on when we can bring in this new entity.
Okay, good. Awesome. And just for background, I know that we've had other reporters ask you this same question, but can you speak on, again, why those 5 community-based testing sites did have to close pretty abruptly?
Yeah, the 5 sites had to close very abruptly after about a day, because Monday afternoon we were notified that UC Davis was not going to get its supply of reagent, which is the chemicals needed to test for the virus. And since that's how we got our test done, that shut off our testing. So we had to shut down the testing on Tuesday, and as it turns out, we'll probably only have to be closed for 3 days.
Okay, only for 3 days?
These 3 days.
These 3 days.
Right now, Wednesday, Thursday, and Friday.
Okay.
And we'll be opening Tuesday.
Okay, will all 5 reopen on Tuesday, or is it like Tuesday, then Wednesday, then Thursday?
No, it's one at a time.
Okay.
We have, I think, Natomas on Tuesday. On Wednesday is La Familia. On Thursday is Robertson's Community Center. I think you have them there. On Friday,
I do have it. Yeah, the
Friday is Sacramento County.
The Robertson. I have Natomas first on Tuesday, then Robertson Wednesday, La Familia Thursday, and South Sac Friday. Does that sound accurate?
That's correct.
Okay, perfect. I just wanted to double check that with you.
Yeah.
We had something else in our notes that said all of them were reopening on Monday, and I was like, I don't think that's right.
No, they're one at a time on Tuesday, Wednesday, Thursday, Friday.
Okay, perfect, awesome. So in the meantime, before these sites reopen and before hopefully we get an additional 5 more sites opening in our area, very exciting. In the meantime, we do have a lot of people that are struggling to find places to go get tested here within Sacramento County. What can we say to some of these people that are reaching out to us and they don't know where to go?
Yeah, so 2 things. Number 1, there are a very limited number of tests that are being done at Cal Expo in terms of the drive-through, so people can go online and try and get signed up to reserve that. That's open every day. And then for these National Guard pop-ups at our community-based sites, we're mostly serving people who had appointments for this week, who we've had to cancel, who we're ending up seeing, but people can certainly try and contact that as well. I should say that if you cannot get a test, and you think you've been exposed to someone, or you've been exposed to someone who has COVID, you should, without getting tested, you should just quarantine for 14 days. So it's not as though it's a hopeless situation. You just do what everybody else would do if you've been exposed to COVID and assume that you potentially have it and get quarantined for 14 days. And after that period, you're good to go.
Okay. I feel like that bit of advice, that's great, letting people know, try to self-quarantine if you feel like you have been exposed or you have been exposed.
Right.
But I feel like that was a piece of recommendation that really we haven't heard too much since the beginning, when we didn't have that much testing available in like March and April.
Yeah, we actually did try and get the message out. I don't know if it got as much out as it should have. But the bottom line is, if you have COVID, whether you get, if you have COVID, you have to be isolated for a good 10 days. Well, let me say this again. No, never mind. No. But I do have one other thing to say about the importance of this, if that's okay. So the importance of these community-based sites are twofold. Number one, they're serving a lot of people in the Native communities where where there's communities of color, working class folks, people that can be dealt with in a culturally appropriate way, and people who don't have a car to get to Cal Expo. That's one important point of what we've been doing. The other one is that the vast majority of people that have been infected in the last couple of weeks are under 49 years of age. In fact, about 70% are under 49 years of age. And they are both healthier, but they also are much more likely to be asymptomatic, not have symptoms, but could be shedding the virus and can be called what are called super spreaders. So we're able to, because we were doing these community-based sites, we've been able to test a lot of asymptomatic people and pick up the cases that would otherwise have spread the disease to others. So that's why it's so important that not only are we reopening these 5 sites, but hopefully we'll be opening 5 more.
With what you said about going back to how our other options for testing right now before those community-based sites reopen, you mentioned we do have the option of the Project Baseline drive-through testing sites, and let's see,
St. Paul's and the National Guard.
So all 3 of those options, we ran into 3 different problems today. So the first option, the National Guard pop-up that was in Elk Grove this morning, we had a reporter out there and they ran out of tests and reached capacity within 40 minutes.
Yeah.
That was one situation. And then St. Paul's, we asked the county about that too. And they said that, they may have just ran out of their allotted amount of tests for the week, because when we called, they said, we're no longer taking any more appointments, but we'll try to reopen on Monday. Right. So there's that. We have both that National Guard one. We have the St.
Paul's and Project Baseline.
And at Project Baseline, I went through personally and put in my own personal information. And at the bottom of the screen, it says, sorry, there are no more available appointments at this time. Try back in the morning. Yeah. So
that makes the point. I mean, we are swamped. We are at capacity in the community for testing now. And so that's why we're so happy that we're able to get our National Guard, not doing a pop-up, but the National Guard is actually going to be working at 4 of the 5 centers, the community-based sites, for the next couple of weeks. And then the fact that we can open up, hopefully, to another 5 sites will open a lot more testing availability to the community at large. But for people who cannot get in right now, and that is clearly going to be the case, and we can talk about why in a minute, but it doesn't mean it's hopeless. Just because you get the test doesn't necessarily mean that you're just getting the test doesn't solve your problem, if you will. So if you think you've been exposed, or you've been exposed to someone who has COVID, again, quarantine for 14 days. And if you don't have symptoms by the end of that period of time, you're free to go. If you do have symptoms, obviously you treat them at home, unless it's very serious, in which case you call your doctor or go to the emergency room.
Is there anything else that you can tell us about those, maybe what went into being able to hopefully open up these 5 additional locations?
Yeah, so this is a national supply chain issue. We're back with it again. It was a problem at the beginning when they didn't have enough testing availability. We've now gotten a lot more people tested, but as we've been getting up into the number of people tested, we're now tested 125,000 people in Sacramento County, which is about 10% of the population, approximately. But they want us to be, the federal government, the CDC wants us to be testing more than that. And so now we're up at this level where we're testing at levels that we should be testing at. And we found that we're running into capacity issues. And we're not the only ones. It's happening around the state. It's happening around the country. The federal government is not prioritizing in the right way how these reagents, these test chemicals get partitioned out to the different states and the different labs. So what's happening is, as was the case back before, what we're all having to go after, scrambling after local and private and small labs all over the place. And that's what we've done. So in not using the big commercial laboratories like Quest and LabCorp, who are also at capacity. So we're having to look for other entities. This is way too long an answer. Yes, it is. I know you can't, you can, I know you.
It's totally okay. It's all right.
The bottom line is that we're stuck in a national supply chain tie-up right now, where the national supply is not feeding to the locals the way it should be. And so a lot of local jurisdictions and states and counties, et cetera, have had to reach out to private small laboratories all over the country and all over the state. And so that's how we've been able to procure, we think, we're close to procuring enough laboratory materials so that we don't run into the problem of inadequate supply down the road. And that'll also, this is a supply that's large enough that we'll be able to serve another 5 community-based sites.
Okay. I think that kind of hits it right on the head. Is there anything else that you want to add that you think we may have missed?
No, I think that's good.
It sounds like you and your team kind of maybe sort of scrambled to try to come up with this solution very quickly.
Yeah, hopefully we'll know by Monday or so.
Okay. Okay, awesome. Well, we'll be in touch with you guys between now and Monday. Hopefully we'll have that big announcement. We can help get out there for you guys. Awesome. So thank you so much for your time. I certainly appreciate it.